Canadian Premature Babies Foundation. So thank you all for joining us. The foundation, as I mentioned before...
Fabi, hold on. Não, voltou. Calma. Vai ter que começar de novo.
Okay.
Okay.
Hello, everyone. Thank you for joining us here today. I'm sorry for the delay. We were having some technical difficulties, but thank you so much for your patience and for being here with us in this difficult time. I'm Fabiana Bacchini, the Executive Director of the Canadian Premature Babies Foundation. And we are doing a lot of work behind the scenes to really stay committed to our purpose of educating and supporting Canadian families with premature babies. So every week, Mondays and Fridays, 1 p.m. Eastern Time, we are holding Facebook Live, bringing experts to address questions and concerns from families across the country and chat with some of our healthcare professionals who's been working really hard during this very difficult time in their units across the country. So also every Wednesday, Kate Robson, who's a psychotherapist and also a mom of 2 premature babies, is hosting real-time online peer support groups, and all the links are shared on our social media, except for the peer support groups. The link is shared on our Facebook group, which is a private group for Canadian families and families of premature babies only. We do not allow other people to be in that group because we really want parents to feel safe. They can chat with each other in the best environment as possible. So we want you to participate in this Facebook Live today. You can send your questions and comments on the comments below on your screen. So, and today I'm very honored to bring you this amazing psychologist who happens to be one of my best friends who I met many years ago when I first moved to Canada. And now she also happens to be a fellow NICU mom. So her credentials is Dr. Chantalone Smith, who you can see on the screen, is a clinical psychologist working private practice in Toronto. She supports children, adolescents, adults, and parents. Using evidence-based strategies, she helps clients to develop a toolbox of skills so that they themselves can effectively improve their mental health. As I mentioned before, she's here not only in the capacity as a mental health specialist, but she's also an NICU parent, here to share her own experience at an NICU when her son was born at 29 weeks. So thank you and welcome for joining us here today. I know your practice is very busy. You're also working online with your patients. And for you who are joining here now, we are going to talk about the common emotional experience of parents who are in the NICU and at home after discharge. The situation we are all now facing with the pandemic adds one more layer of stress and uncertainties for all NICU parents. And Chantal, I was talking to you a couple of days ago, and you spoke about your own experience of being on bed rest antenatal for 39 days, and then in the NICU with your son in 2 different hospitals for another 51 days. And you shared that this is very similar to the isolation we are all living now. And even more so with an NICU parent, there are so many layers of isolation. Tell us a bit more about what we know in terms of NICU parents and their mental health.
Yeah, thank you so much for having me. I'm happy to be spending my break in my day in between sessions with my clients. Today I'm working online as everybody else in the world is doing right now. So I have to say, you know, when I landed in the hospital, it dawned on me very, very quickly that what I was going through, what I was experiencing in a way that a lot of my clients were experiencing, who were not NICU parents, but the intensity of the emotions, you know, was overwhelming, as many of you know, and that really calls for, you know, thankfully for me, I recognize, okay, so now's really the moment to put, you know, the money where my mouth is kind of thing. I need to start to walk the walk as I talk the talk and really help myself to get through what was intense, fast moving, fast changing. At times, it felt like we were making no movements, very, very difficult times. So, you know, as parents in the NICU, we're contended with this idea that the fact that everything that we expected, things that we had hoped for, things that we had dreamed of, did not turn out the way that we wanted to. You know, we're dealing with complicated and very intense emotions at the time. Grief, loss, anger, frustration, anxiety, you know, letting go of those dreams of the baby showers. I think some people I've met in the NICU talked about their birth plan. You know, I was not even that far along. I didn't even have a nursery. Baby moon vacations that we would never be able to take. All that stuff goes out the window when you have a preterm baby. And so the complexity is just, it's all there. Living with this state of uncertainty is one that is hard for most people, for many people, let alone within the context of, you know, some moms are there after, you know, in my case, emergency C-sections, recovering from an infection. You know, I remember preparing for this talk, I was in my memory, I was going back to that time, and I remember saying to my husband, why did I not go downstairs to be with our son? And he said to me, you were unconscious and you couldn't walk, you know, for, I think it was a day or two. So these things, you know, that I think in my mind, I was thinking like, oh, why did I delay it? Why didn't I go down right away? And there are all these expectations that we have for ourselves. And I think that we, with grief and loss, anger, frustration, fear, we move into, you know, sometimes a state of I shouldn't have done that. And we have to move away from that to a feeling, a sort of more constructive way of thinking, which is, I wish I could have, you know, it could have been, but it wasn't. And so how do we move forward? How do we accept what's happened? And how do we go on from there? We know that there's been, I think, over decades of research looking at parents' mental health. We are at greater risk for developing difficulties, right? Just in general, even if you came to the NICU perfectly okay, all the experiences that you will experience will put you at risk. There's a wide range of research looking at, even, you know, as we're talking a lot more about PTSD and acute stress disorder, and they range, but, you know, ones that I've read, 26 to 41% of mothers who experience preterm birth report having those symptoms. And when you compare, you know, 26 to 41% of NICU moms compared to 4% of moms who have full-term babies, that's quite a significant gap. And so we see the need for mental health support within the NICU as being so critical and so crucial. And education about the need and what you might be experiencing, I think is really, really important for us.
Absolutely. And it seems that shock, traumatic stresses, such as loss and grief that we all experience somehow, is an unfortunate but natural part of the NICU experience for many parents. Is there anything parents can do to help themselves to get through this very difficult time and reduce the mental health risk while they are still in the NICU?
100%. Definitely. The good news is that there's research, new and old, I think, you know, a few years back of some of the data that I was looking at that shows very optimistic, very positive outcomes, and the value of, you know, cognitive behavioral therapies and strategies that target reducing negative symptoms like depression, anxiety, and symptoms related to trauma. So I believe strongly that we ourselves can do some of these things. You know, that's the whole reason, you know, we're having this talk, is this question of, do we have to wait until we leave? What can we do while we're already in the unit? But more importantly, I think one thing that I'd like to talk about and present what I'm going to talk about in such a way that it doesn't have to be complex or complicated. I think we can meet ourselves where we're at in the moment, and use the limited resources that we have to be able to do some of these things. We don't have to reinvent the wheel. We don't have to make it complex and complicated. We can just keep it simple and develop at least the willingness to try, right? So the first thing that I always start out with, so for some of my clients that come in the door in my practice, I always look for these things that I'm going to talk about. So the first one is emotion regulating strategies. What are you doing currently that's actually helping? And they're simple, and you're going to, and some of you will listen, you'll say, that's that seems like a no-brainer, right? And funny enough, simple things are very difficult to do. So
actually, you mentioned to me a couple of days ago about all the patients that you see that has this intentional emotional dysregulation, and you help them to find, to develop ways to deal with those emotions and how they can cope with them. And we were chatting, and you said those are very similar experiences that we NICU parents have. So do the same strategies apply and work for us NICU parents in an ICU, after the NICU, or even many years after the NICU? Because we also have parents here like me who are 7 years out, but we still in this moment when everything is happening, put us through back in the NICU with the isolation and the fear of our babies who are now children getting sick again.
Yeah, so one of the things that really, dawned on me as I was going through it, and what I experienced you going through it many years prior to me, was the intensity of the emotions, the overwhelmingness of what you were experiencing and what I experienced when I was in there. Very similarly, was kind of reminiscent of the patients that I see, of the people that I see in my practice. And I believe that some of the things that I teach them in terms of learning how to tolerate emotional distress, learning how to regulate, to prevent negative emotions could work for us. Well, I know it works because I've done it for myself, and I think that it would work for most people, in fact. Yeah, and we know that, that some of the things I'm talking about, all of the things I'm talking about, have been studied for a long, long time. And so the strategies do work. Maybe not all of them will work for everybody, but I imagine some of what I will say will work for some people. Yeah.
Can we share with us? Because I was very interested in when you were talking to me about those strategies. And I just want to share with everyone that you are going to put those strategies in a very simple format that we can share with our community afterwards. We're going to make into a blog post with all those strategies to make available, and you can share with your friends and use yourself if you think it's going to help you.
Right. So we want to start with the basics. Right? So everybody that walks through my door, I start with the basics. And those are simple things. So I use a strategy called ABC Please. And for some of you out there who's maybe been in therapy might recognize the acronym. And we'll definitely post this online as well for you to access more easily, so you don't feel like you have to keep it all in mind. If it is possible, accumulating positive experiences, and that can be used very broadly. It can be enjoying something for a very small moment. It can be anything pleasurable, having a small piece of chocolate, listening to a piece of music that you enjoy, feeling the sunshine on your face, stick your head out the window. We can't be out of our houses right now. Any way to accumulate a positive, pleasurable experience, okay? Building mastery is actually my personal favorite, and it's probably a favorite of mine because I like to learn. And that's where you learn something new, or you hone or fine tune a skill, get better at something, right? So, I was thinking about within the context of the NICU, and now we're all confined to our homes. What on earth could that be? Well, the easiest one that I've been thinking of for most people, even in my practice, is, have you ever wanted to learn a new language? Is that something that you dreamed about? Did you ever think about that you might travel one day and you hope to be in a certain part of the world? If you are at home in your house, did you ever want to try to learn how to cook, or that very special dish? Learning a new hobby, playing an instrument, these things that build self-esteem, that build self-worth, that builds a sense of competency. When I was in the NICU, I actually did this with my baby. So depending on which hospitals you're in, you have some nurses that are really great at being able to support you in learning how to take care of your baby. And my building mastery in the NICU was I learned how to take care of my baby. So, I was pregnant, but I hadn't read any books. I didn't know how to take care of a baby. I don't even know if I'd have changed a diaper. And so I had some nurses in the unit who were so amazing, and they showed me how to do it. And then so I had this routine where I would know my baby. I would change the diaper. I would take the temperature. I would clean my baby. That is also something that I consider to be building mastery, because when we leave the hospital, those nurses don't come with us. So we want to feel masterful. We want to feel like we know what we're doing. So I don't know if, there's many other different ways to do it, but I felt like the most meaningful thing I could do in there was to feel like I knew what I was doing. Coping ahead. Now, I was reflecting on these skills and the way that I actually implemented them while I was in the NICU. I had a real big problem with memory, probably because my hormones were still like, with breastfeeding, I had the surgery. It was just very complicated. I could not remember anything. So I would write down my questions. So coping ahead means planning ahead, right, to be successful. So my version of coping ahead was write down what you want to ask the doctors. And then when the time comes, then you don't have to work so hard. Coping ahead for some parents who are stuck in the NICU could be, if you haven't had a nursery put up yet, you could be figuring that out online, right? Coping for when you're going to leave. Coping ahead could also mean, who am I going to call? Who am I going to access and ask to come and help me? Is it my mom? Is it my mother-in-law? Is it my sister? Okay. That is a useful way to spend your time instead of getting stuck on, sort of this cycle of things that cannot be changed. So being proactive. Okay. And then the last part of the acronym, which spells please, PLEASE, it's basic. It's a no-brainer. And it's also very difficult to do. So treating physical illnesses, taking your medications as prescribed. You would be surprised how hard that is to do for some people, right? It seems very easy, and it's hard. And it's hard because, we are struggling, right? We have high intense emotions. And so I encourage people to set timers to remind themselves. I was dealing with a very difficult infection right after my delivery. And I had a lot of medications to take. And so it was really, really important that I stayed up, on top of that. Eating well. I had a difficult time eating. So sometimes eating well means just eating mechanically, right? We know that food helps us to avoid mood swings. So if you're at risk for irritability, intense mood swings, just having your blood sugar where it should be can be very helpful. And then, when we leave the NICU, sometimes, it's very difficult. And so some people gravitate towards other ways to medicating that are not as effective. So we try to watch things like alcohol and drug use that might actually be making things worse rather than better. And of course, everybody knows good sleep. It's harder to do, I think, when you have multiple children at home. And yet it's something to strive for. I only have one, and I don't know if I've slept since he's come home, but it's something to strive for. And then moving, getting exercise in any way that is possible. So right now, within the context of the being out in our homes in the pandemic, I've been encouraging a lot of my patients to check out online, aerobics classes, I do Pilates on the floor with my son on mats, because we're not moving, right, during this time. And it's, we need to move in order to help ourselves. We know the exercise and the whole mood and exercise thing, it's a well-known fact.
Thank you for sharing that. And I think exercise, for me, I really struggle with that, to just get myself moving. And I think it doesn't need to be a full class online. You can just move for 5 minutes or do some stretches. And I remember when I was in the NICU, my exercise for me was sometimes to just walk around the block outside the hospital. That was my exercise of the day. for not to be absolutely stuck inside and not moving at all. But I think those are incredible strategies that we are going to be sharing with you later. Chantal, Dr. Smith actually agreed to write a blog and to really let us know how we can possibly incorporate that in our daily routine, at least one of those things, if you cannot do it all. But I also want to talk a little bit about mindfulness. Everybody's talk about mindfulness, mindfulness exercise. I just want you to talk a little bit about that and what is the science behind and why does that work?
Well, we already know that there's like a lot of research looking at it. So people are talking about it pretty much everywhere. Oh, I feel stressed. What should I do? You should do some mindfulness. You should go and you should meditate a little bit. Maybe, like download an app, right? And I think that there is a tendency for some of us sometimes to be willful to the idea of doing it because it can be difficult. So some things that people don't really talk about is that mindfulness can actually be a difficult exercise. And the way I like to present it, if you try mindfulness and you find it very hard, it means that you need it a lot. It means that you should practice. It means that you should try, but maybe you go easy on yourself. Maybe you actually do bit by bit by bit and get stronger. So we know through cognitive behavioral science that the way that we think impacts the way that we feel, and it impacts the way that we act, and the way that we feel impacts the way that we think, and the way that we behave, and the way we behave, and so on and so forth, right? So these 3 points, like they just kind of go this way. They affect each other. What happens when you have no awareness of what you're feeling? What happens when you have no awareness of what your thoughts are? What happens when your behaviors are so automatic that you don't even know that you're doing them? That's where mindfulness comes in, right? So mindfulness, I try to remind people, it's not meditating. Meditating can be mindful, but being mindful, you don't have to meditate. The reason we try to do mindfulness is because we know that cognitively, neurologically, it helps us to be able to focus more effectively, to be able to notice more effectively. So for example, increasing attention to negative thoughts, for example, increasing our ability to let go of some of those negative thoughts, staying in the present moment to increase awareness of problematic thinking, automatic thoughts. That's why we do mindfulness. The science behind it is that, if you're at all into the neurosciences, you will see that when people practice this, they actually change the way that their brain functions. Mindfulness is being used for all kinds of difficulties, not just mood, not just for anxiety, not just for stress. We know that there's a lot of research looking at mindfulness for people who have difficulties with attention, even for ADHD, for young children. We are helping them to train their brain to be able to focus and stay with or let go more effectively. And so if you practice bit by bit, it's like building muscles, where you don't start out with muscle training at 300 pounds, you start out with maybe 10, then you do 20, then 25, then 30, then maybe 50, maybe 75. So meeting yourself halfway is part of the journey. A lot of times when people say to me, oh, I tried it and it's really, no, it didn't work for me. They tried it once and they said, no, it didn't really work for me. And then I said, well, what did you do? And they said, well, I meditated for 30 minutes. And I think, wow, that is very, very hard to do. Even, I don't meditate for 30 minutes. So within the NICU, I believe that it's possible to do this in a way where you're not reinventing the wheel, that you're not creating so many new things. Mindful minutes, where you take 60 seconds to focus your attention on one thing in the present moment. It could be something as simple as your breath, right? We all, focusing on the breath is my favorite, because as long as we're conscious and we're awake, we have a breath. And so bringing your attention to your breath for 60 seconds. If you decide to have lunch, spending the first 60 seconds of just noticing, chewing, listening to what your mouth is, feeling. What is the texture, right? If 60 seconds is too hard, I say to my patients, well, then you should try 30. 30 is too hard, try 15 seconds. then build from that and keep going, right? And then before you know it, you're trying to be mindful, and then you notice these thoughts that are coming in, and you note them and you accept them, and you say, okay, so this is what I'm thinking. And so that is the reason why we do it. We do it as a precursor. We do it before we can even notice what the heck is going on in our brain and in our bodies, and how we're behaving, to build awareness.
Right. So it's really to learning how to let go these negative thoughts and help us to get away from those negative emotions. But what happens when those thoughts are so consistent and they don't go away and those negative emotions keep coming? We can't just disregard that they are happening. It's okay, I'm going to be all positive all the time, but you're still feeling those emotions.
Right. Absolutely. Absolutely. I think mindfulness, is a really great strategy for stress relief. It's a great strategy for actually even sort of reducing what we call hyperarousal, the physical hyperarousal that you can have. In particular, if you're prone to panics, that sort of thing with anxiety, you can add mindfulness with abdominal breathing, diaphragmatic breathing, that can help to really alleviate the fight or flight response. Negative emotions, negative thoughts, negative, preoccupations, that's going to be normal and natural. And one thing that I think that comes naturally for some people, for many of us who are going through the NICU experience, because nothing in the NICU experience is like what we had hoped for, right? Like, no one plans to be there. No one wants to be there. And so finding a way to accept the emotions you're currently experiencing, making room for them, is more helpful. Trying to push them away and not accept them, that ends up just, that leads to feelings of sadness, anger, all of that, it doesn't have a place to go. In order for you, like, where do you start once you notice it? Well, then, okay, so let's talk about, how do we acknowledge to ourselves? So for example, in the NICU, well, this sucks. That is true, right? This is a terrible experience that I've just had. My baby is very sick. I am afraid. I am overwhelmed. I am suffering from loss, right? So just even acknowledging what it is that you're feeling is really, really important. For some people, it's harder to notice the emotions. And so that's why we do the mindfulness, to be able to get to this point of being able to say to ourselves, oh, this is what I'm feeling, right? And once you're able to acknowledge what you're feeling, then the difficult part becomes making room for those difficult emotions. Reminding yourself, it's okay that I feel this way. These emotions are valid simply because I feel them. And me feeling them, I have a right to feel them. It's okay to feel them. Allow yourself to have that experience. It doesn't mean that I think it's right if I allow myself to have that experience, but it's much, much more helpful to give it room and to allow it to be. You could also, so if you feel overwhelmed, you can say, I can have these emotions. I know that they will pass, and I'm going to allow it to be right here, right now for a short time. They're uncomfortable, yes. And I know that it won't harm me, right? Because sometimes there's a feeling of coming apart at the seams. I will not survive if I allow these emotions to live within me. And that's simply not true. You can deal with the difficult emotions and you can still choose to go on. The self-validation that comes from allowing yourself to acknowledge and then to have the experience of allowing it to exist then leads to, okay, so then why am I feeling fear? Okay, so this idea of like trying to understand and make sense of your emotions. Well, I'm fearful because none of the doctors can tell me that my son will be okay, right? So what does that lead to? Well, all kinds of imaginations, right? And all kinds of potential possibilities of how bad things can be. My fear makes sense given the context of where I am. Even those three things that I talked about, so acknowledging what it is that you're experiencing, allowing yourself to have that emotional experience, and then making sense of that experience. That's the whole process of learning how to self-validate. When I was in the NICU, it was really hard because the context of my setting was that I was in the level 3 and I was alone. And I noticed a huge shift when I moved to the level 2 because I was more congregated. And I discovered the value and the meaning behind validation from others. And so I cannot talk well enough of the importance of having peer support, the importance of being able to reach out to someone who gets your story, the importance of being able to like say your story, to speak your truth, and having someone hear it in such a way where you feel like, she gets me in a way. She knows what I'm trying to say, because it's easy for him or her to validate that experience, right?
And I think that's obviously we all know, because we all have been in those shoes, when we provide peer support to other parent and a parent understands like this is a safe space and I know what you're feeling. So you don't have it to justify what you're feeling, because we get it. So I think that's the power of the peer-to-peer support, that we work so hard on it. And unfortunately now all the peer support groups in hospitals have been suspended because of the pandemic, but that's why we're offering online peer support, and we have a very big online peer support group, which is closed for parents only, that I think we all meet our community there, that you understand each other's struggles, we validate each other's feelings. That is so very important. Dr. Smith, I'm just aware of the time a little bit, but I really want you to talk a bit about the acceptance of how can we accept what is happening now in this context of the pandemic, because we talk about being in the NICU in a regular circumstance that is hard enough. So now we are adding this extra layer of the pandemic, where parents are not, don't have open doors as they used to be in the NICUs. Many NICUs in Canada have a new policy of having one parent at a time in a 24-hour period, which is extremely hard. If moms are breastfeeding, fathers are not coming to the unit. And so we understand that this is a very, very difficult situation, and hospitals are trying to work with the best that they can with the knowledge they have in the present time with the COVID-19 that is so new and is changing so rapidly. So how can we accept what is happening now to still be in a place that we can cope with it in a way that, yes, down the road, we're going to be okay?
Yeah. So this is, we're talking about layers of complexity here. And a lot of what we're talking about today, they're easy in concept and difficult to implement. And yet, nevertheless, a willingness to try is what's going to get you through some of it. Acceptance of the current reality really requires you to acknowledge the reality without the wish that it will be different. And that's the last part, without the wish that it would be different, is the hardest part, because full, true, radical acceptance of the reality requires that second piece. And sometimes, you can get there by doing what I call sort of like balanced thinking. So in my work, I call it keeping things dialectical. So dialectical means two opposing things that are true at the same time, right? And I always use it's like, I don't want to get up and go to work, and yet I will, right? So there's this idea that this exists and this also exists. I remember thinking back, I don't want to be here. I don't want to be here right now. I don't want to have to be going through all of this. And this is the safest place where I and my baby can be, right? You can accept that you don't like something. You can accept that something is unfair, but to get stuck on what I call extreme thinking, fair, unfair, right, wrong, black or white, that's the stuff that makes it hard to be able to move on. And so being able to somehow in your experience say, okay, so, one that's I think very common to most parents is, my baby's not improving, he's not where I want him to be on this particular day. I thought he would have been better by now, and at the same time, the balance is, he's not back at day one. He's made some gains, right? And so we're hearing all kinds of things, I think, coming through the grapevines about what's happening. Partners are not allowed to be with their babies at birth. Is that like what's happening in the hospital? So there's one parent in at a time, no family visiting except for mom or dad, right?
Yeah, different hospitals have different policies, and families in Canada, as far as we know, there is one parent at a time. We are still in contact with many hospitals across the country to see, as the policies have also been changing so rapidly. So
Yeah.
but as far as we know, parents are coming to the unit, but it's just one at a time.
One at a time. So that's what the main difference in the past from the past is right now it's one parent at a time per, I think, 24-hour or something like that to sort of control.
In most units, as far as we know.
Right. And in the past, it used to be that you and your partner could go, and maybe even, I think where I was staying in the level 3, I think it was like up to 3 people. You could have one person in other than the 2 parents. It is a hard reality, even outside of the NICU right now, right? This situation that we're all living in, and getting stuck on it's unfair, this shouldn't be, not accepting reality is what's going to make it difficult. So if you can find a way, if you could find a way to hold both truths, and a good way to think about this is like the glass is half empty and half full. You know, I remember the very first time I was laying in bed after being told at 8 a.m. in the morning that I was not going to go to work on a Monday morning like I thought I was planning on doing, and that I don't have a hospital bag with me. I just went in for a checkup. And my initial reaction was, I'm not staying here. I'm not, like, I didn't plan for this. I'm not ready for this, right? And it took me a while. I think it took me the entire day after talking to multiple doctors before I realized, well, okay, so I don't want to be here, and I'm actually making the choice to stay, right? We don't want to be in this situation. It's not fair that only one parent gets in at a time. And I wonder if you can find a way to come to the place where you recognize, you know, I don't like the situation, and yet I'm going to choose to do the best that I can in this particular situation, right? At this point, that is all that we have. And we know conceptually how it's supposed to be done, and we know that it's difficult to do. So I ask people to practice it in small ways, you know, outside of the situation as much as possible if you can.
Okay, so we talk about, you know, all these emotions that we as NICU parents experience, and we talk about guilt and loss and grief and acceptance. But when is the point when the parents realize, okay, this is beyond what is the norm or beyond what I should be happening, and I cannot cope, what they should be doing, and when people should actually look for professional help because they realize they cannot cope anymore?
Right.
Or is it at some point that is, okay, I am at risk because of this.
Mm-hmm.
Should I be proactive and act on it and look for help immediately?
Yeah. So, you know, the self-validation parts allows us to understand what is normal given the circumstance, right? So we do that part because it makes us feel like, okay, so we're not losing our minds. These emotions that we're feeling, they make sense. And so that helps us to feel more okay. But we do know that there are certain factors that put some of us at more risk than others. And so I'm a big believer in early intervention. I don't believe that you need to have a diagnosis to fall apart at the seams before you try to get help. So we know that there are certain risk factors that make some parents more at risk than others. So in particular, I was doing some reading about PTSD, and we know that that mothers who have had emergency deliveries, who have had operative births, you know, with using forceps and vacuums, that sort of thing, that actually creates a predisposition to be more likely to experience more significant problems, especially after discharge. If you have a pre-existing trauma that you've experienced in your life before you ended up in the NICU, that's also a risk factor. If you feel that you've lost control of the situation, you've had a really significant negative interaction within the unit, within the NICU, with staff or with other parents, a loss of control, that we also know is a risk factor for developing PTSD. Any sort of perceived lack of partner support, if you feel like you have no support, people don't understand you, and those feelings don't go away, that puts you at risk. If you're panicking, if you are not moving in the direction of feeling better, so that's another, you know, it should be getting better bit by bit after you're released. That is the time that you should actually be reaching out to. So I believe in all the units, there's definitely social worker. They have access to referrals for psychiatry. Sometimes you can't do the work until you have medication. Sometimes for some people, you need the medication before you can actually learn how to help yourself. And so don't feel any shame about that. Ask for the referrals, get the medication, take your medications accordingly. Your GP can make that referral, or I think within the units, right? The social worker or the neonatologist can help you to get hooked up with psychiatric help. So that's when. Any thoughts of self-harm, obviously as well, automatically you should be reaching out to someone. And that's sort of like a really important sign that you're not coping well.
Okay, thank you so much. And I think the message is very clear. Do not be ashamed to look for help. Do look for help, because things sometimes do not disappear on their own. We really have to do some work and get help when it's needed. So thank you, Dr. Chantalone Smith, for joining us here today and taking the time away from your practice. We are very grateful for you to share your knowledge, your expertise, and also your own experience in the NICU. And for all of you at home, thank you so much for joining us. Just a reminder that on Monday, 1 p.m. Eastern Time, we have another Facebook Live. And on Monday, I'll be chatting with Dr. Michael Narvi. He's a neonatologist in Winnipeg. And also, he has an amazing blog called All Things Neonatal, where he talks about everything related to the NICU. And he launched the Parents Corner that explains in a very plain language anything about prematurity. So it's a great blog. It's a great doctor. He has a lot of information to share with us on the COVID-19, labor and delivery, what's happening after the mom delivers the baby, when baby goes to the NICU. So any questions that you have ahead of time, please send to us. And join us 1 o'clock on Monday. And again, every Wednesday, Kate Robson is holding a real-time peer support group here on, just join our Facebook group, is Canadian Preemie Parents Network. So thank you, everyone, and have a lovely weekend wherever you are in your house. Bye for now.
You still there? Fabi?